Hey guys, Prostate Whisperer here. Today's episode of Urology Pimp Questions, we're going to talk about why does prostate cancer rarely spread to the rectum? Now you think about prostate cancer, which is a very common cancer, and think about how many times the rectum is involved, right? If you go in a clinic for prostate cancer screening with your PCP, you very well may be getting a rectal exam. If you have an elevated PSA and you need a biopsy, that's also going to be through the rectum in most hospitals with most surgeons at this time. So why does prostate cancer, which is so close to the rectum, rarely metastasize to the rectum? And it really comes down to a simple anatomic structure called Denain-Villiers fascia, or the rectoprostatic fascia. Now the prostate and the rectum are right next to each other. They're practically neighbors. But the reason you don't see prostate cancer just bulldozing its way into the rectum like a bad roommate is because there's a thin but tough sheet of connective tissue, and that sits right between the prostate and the rectum. Think of it like a wall, but not just any wall. Denain-Villiers fascia, or the rectoprostatic fascia, is highly dense and does an excellent job at keeping cancer cells from spreading across that boundary. And it also lacks lymphatic channels, which are an important feature of many anatomic structures that allow for cancer to track along it. Denain-Villiers fascia was named after a French surgeon, Charles-Pierre Denvilliers, who first described it in the 19th century. So basically, if you're in the OR or you're in the clinic and you're a med student and you're asked about why prostate cancer rarely spreads to the rectum, you have your answer now. There are other structures in the pelvis, like the bladder neck or the seminal vesicles, which serve as typical first locations that prostate cancer likes to spread to. But if you're seeing a prostatectomy and you're seeing the surgery in the OR, you will be able to visually see a pretty sturdy piece of fascia that's separating the rectum and the prostate. Thank you very much, guys. Please like and subscribe for more prostate cancer and Prostate Whisperer videos.